So good morning, everyone. We're just waiting another minute for the other participants to join. So please feel free to grab a glass of water or a glass of coffee and make yourself comfortable. Okay, so I think we will get started. So welcome everyone, and thank you for joining us today for our webinar to explore the Shift Hub services, or your gateway to accelerate smart health innovation. My name is Alena Bubek. I'm a project manager at the Steinbach Europe Center in Germany. I'm also the coordinator of the Shift Hub project, and I will be today's moderator. So today actually marks an important milestone for us in the project, as Shift Hub has entered its final phase, and it's now really our pleasure to present you what we have developed and established over the past 3 years. And as you might know, Shift Hub was launched to accelerate Europe's transition towards the smart health solutions by really fostering here collaborations among the ecosystem stakeholders, so innovators, healthcare providers, SMEs, and policymakers. And over the past 3 years, we have built quite a comprehensive ecosystem of services to really help the stakeholders innovate responsibly and also scale the digital health solutions together. And as now our project concludes with this webinar, it's our pleasure to present you an opportunity to really discover these services, understand the benefits, and also learn how they can be accessed and replicated for your needs. So therefore, we have designed this webinar to give you first a complete overview of our services offer and what we have achieved. And then we will have a closer look on certain services and really cover how you can benefit from these services and tools that we have created, and also how you can adopt and replicate these. And as you might already know, our services are structured into 3 different pillars, which are based on the value that they create, which are either to build and boost your innovations, to connect and thrive collaboration, or to learn and grow knowledge and skills. And for each of these pillars, we will hear how their services translate into real-world opportunities. So covering, for example, open innovation workshops, living labs, the community platform, or policy recommendations, and also learning resources, amongst many others. And as you can see, after each of these pillars presentations, we will have a dedicated Q&A session in which you can further exchange with the consortium partners and really explore how these services might fit your needs. And as you might have already seen, the webinar will be recorded or is being recorded and will also be uploaded on our YouTube channel later on. So please feel free to share it with anyone in your network who might be interested in the services as well. So most of you maybe already know that Shift Hub has started almost 3 years ago from now as a coordination support action funded by the European Commission. And that means that we're not a project that is doing research itself, but we are coordinating and implementing support actions for innovation ecosystems and also networks basically across Europe. And that was exactly what we were doing with the received funding. So we were creating a Smart Health Innovations and Futures Technologies Hub, which really aims to foster the development and the uptake of smart health technologies across Europe. When I say we, I'm referring to our 12 partners in the consortium, which represent important stakeholders and expertise within the smart health ecosystem. This includes, of course, 3 universities as our knowledge providers, then 4 organizations as innovation intermediaries with experience here on how to support and connect different stakeholders, then 3 technology providers, of course, providing the different tools for our services, and also 2 more partners which are specialized in engaging certain target groups, which included here small and medium-sized enterprises and technology providers, as well as patients. And together, we were working towards our main goal, which is to facilitate the develop on one hand, but also ensure the promotion, and then finally, of course, foster the uptake of the smart health technologies and services so that they really reach the people that need them. And for that, our hub is providing different services to all the stakeholders of the smart health innovation ecosystem. That first and foremost, of course, includes the citizens, the patients, and the healthcare professionals, but also the developers of these new smart health technologies and the policy and the decision makers. And the services now our hub offers are centered around the 3 pillars, which I mentioned in the very beginning. And they all represent 3 key values that are really designed to meet the needs of the different stakeholders. So as I've already said, there are either to build and boost the innovation, to connect and thrive collaboration, or to learn and grow the knowledge. So basically, whatever it is you're looking for in value, you can find a respective service listed in our hub. And so when we quickly look at these different pillars, you can see that the build and boost pillar contains mainly services to support the development and the uptake of smart health products. So these are services which are rather targeted towards the technology providers and the developers themselves. And the services you can see here, they range from generating new ideas or finding the right partners or funding access to really showcasing the developed solutions then to the end users. So with the service offer here, we want to basically, cover the entire pathway of app development and support you with that. Then in the pillar in the middle, it's the Connect and Thrive pillar, and that contains services to really foster collaboration and exchange among the stakeholders of the smart health ecosystem, as well as really to build and support here one comprehensive smart health community in Europe. And the central point for that community is our community platform, which you all know because it hosts several online events such as today's workshop or other matchmaking opportunities, webinars. And it's really a central platform which is, acting to connect our community stakeholders. And one of the key initiatives of that community is also the focus group on eHealth, which is a network of experts and also community members that anticipate to be more active. So within that focus group, we exchange and collaborate on different topics such as shared data spaces, AI, or cybersecurity, with really the goal to inform decision shaping in the European smart health sector. So if you're interested in that, you might want to look forward to one of the services presentations later. Within that pillar, we also established collaborations among ecosystem stakeholders, including, of course, the policymakers. And this relates to our entrepreneurial discovery workshops in which we identified, compared chances, barriers, and structures between regional innovation ecosystems and got the policymakers here involved and also draw some policy recommendations from that. And they will also be introduced later on. Then in the third pillar, we have the learn and grow values. And here we focus really on services to foster exchange of knowledge and also best practices. So some of these services focus here on citizens and smart health professionals, such as the collection of educational resources on smart health and digital applications, or our gamified user journey, which is really directed at the citizens to really increase the population's knowledge on health-related matters. Or the other service in that pillar that focus more on the exchange of professional ecosystem stakeholders, such as digital innovation hubs, research organizations, or healthcare providers. And these were our capacity building workshops. So in these workshops, we really facilitated the knowledge exchange and best practice sharing of different methodologies, such as open innovation, access to funding, or even living labs. And the results from all of these workshops were collected and summarized in our best practice sheets, which are openly available on our project website. So I encourage you to have a look at them and download them on our website if you're interested in these methodologies. So this has only been a very high-level overview from my side about the project and the services and the tools that we have developed, because now our Shift Hub partners will introduce their services in more detail. And with that, it's now my pleasure to introduce our first Shift Hub partner, which is Joana Carrillo from the University of Porto. There, Joana works as an international project officer and is also the work package lead for exploitation, uptake, and sustainability activities. And she will now give us an overview about the complete service offer that Shift Hub has to offer and also the value it creates for you and the other ecosystem stakeholders. So, Joana, the stage is yours.
Thank you so much. Just trying to share my screen very quickly. Here it is. Okay, so hopefully now you should be able to see my presentation in presentation mode. Okay, perfect. So yes, thank you so much, Alina, for that quick introduction. So the idea is to go over with you very quickly about how ShiftHub can interact with you and how we can offer value, as Alina mentioned. So I'm sure most of you will be familiar with this graph. It's the general concept in literature of what is the journey on entrepreneurship and value creation in innovation. So the idea is that you, of course, start with having a concept and then you try to find some value added in it. And then, of course, in order to transmit this value into others, you have to try and find some influence and try to get others buy-in into what your idea and your concept is, and then you have to build your assets throughout time so that then you can have a stronger and more sustainable value proposition. So with this in mind, what we did throughout the project in ShiftHub throughout these 30, almost 36 months, was to go back to our stakeholders, which were the people who were actually creating this innovation or in need of this innovation. So we mostly did some grouping of our main stakeholders into two main types, which were the solution providers and the solution procurers. And we tried to understand what their main needs were and what they were looking for. That ShiftHub could grant them. As Lena mentioned before, we have a rather comprehensive consortium, and so we were well positioned to try and find bridges wherever we could, or to facilitate some of the things that either these procurers or these providers were looking for. And so here you can see in this word cloud some of the things that were translated to us as things that were needed by these stakeholders. So as you can see, a lot of it had to do with the establishment of relationships. The other ones had to do with understanding how they could better service this market that was related to digital health and innovation in digital health, whether it was because they were lacking access to where the solutions were, or because they had the solutions, but they needed support into translating them into the market. So overall, we ended up doing this sort of organization, and some of these things Alina has already mentioned, but we were focusing our service offer into going into different areas of the innovation pathway in order to facilitate what could be the existence of this innovation and in this value creation for all types of stakeholders. So as you can see in this graph, we were trying to look into different quarters or different aspects of society and the ecosystem and innovation, and try to find how we could then offer value for them. So this is only some of the examples of that portfolio of services, but I think these were the ones that are more symbolic, and some of them are just derivatives of this. So if you will allow me very quickly, I'll go through this idea with you with the type of value that we are offering to different types of stakeholders. So I'm going to start at the bottom. And so we were concerned with promoting smart health literacy, because either from the side of the citizen and patient that needs to understand better what type of issues they have and what type of solutions technology and innovation can provide to them, but also from the perspective of the healthcare providers who are obviously in need of being constantly updated into what new solutions have come up and what technology can now do for them and facilitate their work. So we were much focused on this and try to give tools and skills to our stakeholders so that they could then better use and better appreciate what type of innovation companies were bringing to the market. On the other hand, when we were trying to talk about these innovations that are already in the market, not only do people need to know how they work and how they can offer value to them, but also they need to understand of course, how they best suit their needs and how best they can shape them. So we were very concerned with things like the creation of opportunities for co-creation and development. We did this through the implementation of living labs so that then we could have solutions that were built, and I love this expression, for the people, with the people, and by the people who are actually the end users. So we were working a lot into creating these spaces and these opportunities for companies to go to their end users, whether they were patients or healthcare professionals, and to jointly develop solutions with them. So we were here offering value not only to the citizens that were then being given access to solutions that were specifically tailored to their needs and their preferences, but also to the companies who were now being able to have a much smoother and hopefully more successful transition of concept to market, because the prospective clients were already onboarded by these solutions. They were already part of this process of creating them and bringing to the market. Then we had to deal with things that were more logistic about this. Of course, this also ends up coming to the question of funding. Of course, innovation needs to be developed, and for that, the innovation creators need to have access to funding and to resources. So we tried to facilitate as much as possible this access to funding directly through helping these companies and solution providers to access funding opportunities, but also a lot through the promotion of cooperation and networking so that they could then meet like-minded people that would have access to resources, whether they were financial or technical. So we were dealing a lot with this. And then finally, again, we had to showcase these innovations. And we did this through a series of methodologies. One of them was using demo days or demonstrations in some sort, so that then companies and solution providers could find a way of reaching to the community that they were targeting, but also through these open innovation workshops that Alina's mentioned before, and that we will go into further depth later on this webinar. But the idea is also to again bring visibility to the solutions, but also give the solution creators visibility into what the market is needing and what the market is trying to find right now as their top priorities. So these were the main ideas behind what type of value we were offering to our stakeholders. Again, as you've seen before, we have then our services within three main pillars. Alina has shown them to you. Again, the idea is following that logic of the roadmap of developing innovation. Again, starts with building and boosting the ideas that you already have. And again, we did this by giving these opportunities for co-creation and testing with the living labs and the access to a lot of these exposition to the exterior with the open innovation workshops. Afterwards, you have to obviously, following that same graph I showed you in the beginning, you have to find a way to connect to your community and to find either people will support you, people will be part of your journey, or later on your potential clients. So we were very focused on this idea of connecting all actors within the innovation ecosystem. And then, of course, we had this idea about learning and growing. And here you have all of those initiatives that I told you before about capacity building and promotion of health literacy and promotion of digital skills. So we had all of this learn and grow pillar. Oh, here it is. So overall, the idea would be to do this in the three stages that I told you about. So first of all, we wanted to engage the stakeholders, and you have a series of things that we did in that sense. Again, we went to the stakeholders and understood what their needs were. Then we tried to connect them to each other and to other initiatives, and that would go into the second stage of supporting and connecting. And then later you have this question about value adding. So if we want it to be a project that not only existed within the boundaries of this European funding, but we wanted to make sure that we were giving our ecosystems the tools and the ways to then succeed in the future and have sustainability in these initiatives. And this is what brings us to the, sorry, okay, here, into the later stage of the project, which is this idea of the then exploitation and uptake and sustainability, which is what I wanted to talk to you very briefly about, which is what are we planning to do in the future with the Shift Hub service offer. So we wanted to find a way to disseminate this and to find other like-minded initiatives or companies or other institutions that would be interested in replicating the methodologies and the services and products that we have created throughout this project. So the idea here is that we would like to connect to other institutions outside of the project, which is why we are very glad that you are all here today in sharing this interest in seeing what we've been doing. And we wanted to do this in 3 steps. So first of all, we wanted to make sure that the community knows what we've been doing. And this is what we've been trying to do with these webinars, what we try to do through our website and through other initiatives that we've done by presenting the project and the service offer in external events. So first of all, we wanted people to know what we do. But not only knowing it as a concept, but we wanted you to be able to test it. And for that, you will again hear from different partners throughout this webinar, and those would be the people who would be your main contact points. We will make sure, of course, to give you all of the contact information, but let's say you're very interested in one specific service that we have. So we invite you to reach out to those people and to test those services for yourself. We can do this in a series of ways. If, for instance, if you're interested in having access to one of our repositories, whether it's the app repository or the educational repository, we will be more than glad to give you access to the actual library so you can explore it, you can use it, you can test it in any way you would like. The same thing applies to the methodologies. Let's say, for instance, for the living labs, we would be glad to facilitate a session so that you could test for yourself in your own conditions what type of methodology we're using, or so basically you could test what it is and what type of solution or product we are presenting. And then hopefully this will suit your needs. And then we would be very glad to support you in creating a replication of whatever we're doing. Again, if it's some type of repository that we've created, we would be very glad in helping you establish this within your own library. We would support you and train you and capacitate you into the methodologies that we've created. So the idea is that you would then go into the last step and you would be co-owner of this service or technology, and you would then be able to implement it in your own ecosystem and to then hopefully engage others into becoming replicators of that thing itself. And we would have this multiplying effect of what we've been creating in the project. So that being said, I would invite you to, again, within this webinar, get to know our service offer and then reach out to us as much as you would like so that then you can test these services for yourself and then hopefully bring them into the future, into fruition in your own ecosystem. And that's what I had to say. So thank you so much for your attention.
Thank you, Joanna. Perfect. So we will actually directly dive into the presentation of the services before we have a short Q&A session. So with that, I'm now opening the second section basically of our webinar with our prospective service Shift Hub partners introducing our services or certain services more closely in more detail. And the partner that represent these services, they also serve as contact persons if you're interested to use or adopt any of these services. And we will actually start with the services under the Build and Boost pillar first, which is all about supporting the development of your innovations. And as our first speaker, I would like to welcome Anastasia Papachristodoulou from Kino Innovation Intermediaries. At Kino, she works as a business and innovation consultant in projects related to the field of open innovation, skill development, and technology transfer, amongst others. And today she will introduce us into the open innovation workshops and the methodology behind that. So, Anastasia, the stage is yours.
Thank you. Thank you very much for the introduction. I'm going to share my screen. So, can you see my screen?
Yes.
Perfect. It's full screen. So hello from my side too. We're going to see together in a few 4 or 5 minutes, the next 4 or 5 minutes, the methodology of open innovation and what we're talking about when we're referring to open innovation workshops. So this is the first service of our service offer from the Build and Boost innovation pillar, as Alina and Joanna said earlier. And to start with, when we're talking about open innovation, we should start from the question, what is innovation? So innovation is defined as the transformation of an idea, practice, or an object perceived as new by an individual or a group of individuals into a product or service or production and distribution method. So as you can see in this figure, innovation is turning knowledge into money, while research is turning money into knowledge. And proceed further, we can see 2 different innovation models. So we have the closed one, where the innovation development process is more internally within the boundaries of the company, and the transformation of the initial idea to a product or service is done by the employees of the company. While this innovation model is more limited within the business boundaries. On the other hand, when we're talking about open innovation model, this is a more interactive and open process. So here we have interactions with external stakeholders of our environment within the innovation ecosystem. And in this way, we can attract new markets of other businesses. We can get feedback and input from other stakeholders in order to develop ideas throughout the whole innovation journey. And more precisely, open innovation workshops focus on creating a cross-fertilization process among representative stakeholders in order to be able to co-design and co-develop solutions that answer real-world needs and current sectorial challenges. This type of workshops leverages an SME-centric open innovation methodology, while the stakeholders are participating in these workshops in order to brainstorming, generate new ideas and new project leads, elaborate roadmaps, and finally implement a co-design innovative solutions. So this leads to a collaborative approach where participants can generate ideas and co-design solutions. The main objectives of this type of open innovation workshops are to explore in depth the needs of the healthcare sector or any other sector that we are involved in. We can discover technological solutions that address real-world challenges, generate innovative ideas, and be able to support the emergence of cross-sectoral collaborative research, development, and innovation technology transfer projects. So in this sense, we have many different categories of stakeholders, like end users, partners, employees of companies, society and community that can be benefited by these open innovation workshops. How they can be benefited, the end users can co-create and develop better solutions for the existing needs and challenges. They can feel that they belong in an innovation ecosystem and in a broader community in order to receive feedback, to give feedback, and to be part of this community. For the partners, meaning academia, research, other private companies, they can develop shared resources, they can reduce their R&D costs, and they can create new opportunities in order to develop future medicines, access to funding, and be able in general to collaborate with external environments. For the employees of the companies, we can see benefits relevant to the development of their skills by training, the empowerment which fosters a culture of creativity and continuous improvement, and the solving of problems which address real-world challenges. And finally, for the society and community, we can achieve sustainability because of the development of solutions that can address environmental and societal challenges. And finally, to achieve local impact via the support of regional competitiveness. Who can use these open innovation workshops, this type of workshops? For sure, companies, SMEs, startups, large corporate, in order to receive external environments feedback. Educational research bodies like universities, research centers, laboratories, public entities, innovation intermediaries, and non-profit organizations. What are they expecting? All these organizations, they seeking external ideas, solutions, talents, in order to co-create sessions to solve challenges that address real-world needs and existing challenges. And they can develop in this way more targeted products and services, leveraging both local and broader innovation ecosystems feedback. So here, if you'd like to learn more about this type of workshops, open innovation workshops, you can visit our website, CIFHub website, where you can find our best practices guide, the presentation of the open innovation workshops methodology. And finally, you can also see the report of capacity building workshops, where we discussed and analyzed in more detail the open innovation approach. If you need any other clarification or have additional questions, you can reach directly to me via the email that you can see in this slide. Thank you very much for your attention. And if any additional question is, you have any additional question, I can answer you. Thank you.
Thank you very much, Anastasia. So we will actually present all the services under the first pillar, which is all about boosting the innovations first, and then we'll go into the dedicated Q&A sessions. So I will now would like to welcome actually our second speaker to present our second services we would like to present, and that is more about really showcasing innovations and promoting them among the end users, so more developed solutions that are already closer to the market or more developed, and that is within our demo days. So now it's my pleasure to welcome Adamantios Koumpis. He is a teaching and research officer at the Institute of Biomedical Informatics at University Hospital of Cologne, and I'd say the father of the demo day methodology he's now going to present. So Adamantios, the stage is yours.
Thanks, Alina. I will use as opportunity a question that one of the attendees has posted to all of us. So, hi, Gianpaolo. I see that you just sent before a few minutes a question. Hi there, thanks for your event. What interaction could be seen from CIFHub with our activity? Good question, because actually all our services that are presented today relate to opening up, building a bigger, wider community, so not continue navel gazing, but opening up to bring stakeholders and potential interest parties from outside. So about what you mentioned there is that from your side, you mentioned that you can follow virtual neoadjuvant therapies in a macroscopic histopathology framework using 3D geometries derived from baseline diagnosis for breast cancer. So this is a very good lead for me to talk about demo days. The idea is that all over Europe, there are researchers, scientists, startups, groups in universities or research centers that they are doing research in some area with possible or potential applications in something. For your case, it is about breast cancer and baseline diagnostics. The idea of the demo days is very simple, extremely simple, and it is about offering a forum to everyone who has some technology at a different stage of maturity, so the technology readiness level may be quite low or very advanced, so that they will present these and get in contact with potential investors, potential partners, so that they might bring their innovation or their research idea one step further. So if something is at a very early technology readiness level, to bring it from TRL 1 to 2 to 3 to 4 to 5. So this is a very relevant context. So now I will very briefly, because the idea is that we will only use 5 minutes each of us for our presentations. I will not abuse the kindness of the other people. So here also in some slides, the demo days, as I mentioned, were about creating ideal conditions for showcasing innovative solutions. And solutions can be not necessarily mature turnkey products. They can be also something that may be at a very early stage of research. And the events are not about giving visibility, but also helping validate the relevance, which means that by exposing what your idea or your research or your service or product is to a wider context of people, you may receive also useful feedbacks that may guide you in further elaboration of your research. And so, in short, demo days are not presenting companies or showing slideshows. And here again, from our experience, a problem we faced. So we have held now how many demo days? They may be about 7 or 8 demo days, and we are planning still for January and February demo days. But a problem we had is that some of the presenters, instead of showing something, what they have, they used time in providing lectures about the opportunities in markets, the potential, or who they are, while failing to convey a message about what specifically they are building, what specifically they are doing. So this is something that we still have to communicate in a more straightforward way. And the idea there is that each presenter has 20 minutes that they can use to show something that they may trigger people's interest. So about your question there, the idea is that people who are involved in attending demo days, they may be university hospitals all over Europe, that they might be interested to bring you as a partner in their future projects. So it's not necessary that they will be investors. And in many cases, many people present themselves as potential investors, but what they might be useful to you is to involve you in some fundraising activity, which is still good. And also what was mentioned before is that we have these best practice information sheets that they are about each of our services, and there is one relevant also for demo days where you can see more specific information about what was this modality and the format that we followed, and also be able to get in contact with us about this specific modality of the demo days. So thank you. I think that I didn't abuse my 5 minutes limit, and we can proceed to the next presenter, Alina. Thank you.
Thank you very much, Adamantis, and thank you also already for targeting the question. I was also about to write an answer to that, and we will also address it in the Q&A later. So basically, just a summary, today's webinar is really about showing the different services and different offers the Hub is offering, so that you can decide, depending on the need you have, what might be of interest to you. So are you looking more for something that is related to your innovation, helps that drive that? Or are you looking for new collaborations to connect with people? Or are you looking for, if you're a healthcare professional, for example, to exchange with others, to increase the knowledge on certain topics? So this webinar is today to give you an overview about the different services we offer, so you can see, depending on your needs, to whom to reach out to get more, I'd say, details on that, and more specific help. So this is why we're having really short presentations today, to kind of give you an overview and get you interested, if that helps for now. Okay, so we will go on actually with our third presentation. So under the Build and Boost pillar, we're still within the first pillar. And for that, I'd like to welcome Anita Varela. She's a research assistant at the Medical Physics and Digital Innovation Lab in the School of Medicine at the Aristotle University of Thessaloniki. And Anita is the task leader of the Living Labs in ShiftUp, and she will now introduce our Living Lab approach to you, and how that can help you co-create your solutions together with end users. So Anita, the stage is yours.
Hi, Lina. Thank you very much for the introduction. Please allow me to share my screen.
Mhm.
Is it full screen or not yet?
Yeah, we see the PowerPoint, but not the presenter mode yet.
Okay. Should be fine now, right?
Yes, full screen. Perfect. Thanks.
Perfect. Thank you very much. So I'm going to be talking about Service 3 Living Labs and how they can empower citizens to shape the future of health. So what are living labs? They are dynamic user-centered, user-driven environments where innovation is co-created, tested, and validated in real-life settings. They allow to bring different actors, so citizens, companies, universities, and policymakers to address these real-world challenges. They provide immersive and interactive spaces for citizens, vulnerable populations, and patients to engage with different smart health digital solutions. So they enable actually end users to give feedback throughout the different testing phases and thus ensure solutions truly meet their needs. Therefore, we can facilitate a smoother adoption, greater impact of these solutions, and of course, long-term sustainability of innovations. So what are the key target stakeholders and the benefits for each stakeholder? First of all, technology providers and knowledge and infrastructure providers. This can be startups, spin-offs, research centers. They have the opportunity to get feedback from citizens and patients about the different technological solutions under development, gain sustainability of these solutions, and of course, increase visibility within the healthcare sector. Other stakeholders are healthcare professionals and health organizations. They have the opportunity to discover all these different innovative solutions that address patients' needs and challenges. Also, they can participate in the co-design process to ensure that these technologies align with their needs. And finally, citizens and patients, they can benefit from using the technological solutions under development, actively participate again in the co-developing of these solutions with technology providers, and therefore make sure that they will facilitate the quality of life. So what are some success stories of living labs? A very distinct paradigm of a successful living lab is the Thessaloniki Action for Health and Wellbeing Living Lab, THESAHAL, here in Thessaloniki in Greece. So the goals of the Living Lab is to establish interdisciplinary cooperation, co-create innovative technological solutions and best practices through implementing Living Lab methodologies and techniques, allow open access and experimentation within the infrastructures, and allow for knowledge and experience exchange. In order to achieve all these goals and actually make it practice in real life, we have developed a collaboration and research community for independent living. So the partners of experience, as you can see, these are the collaborators, the co-designers. And how we can do that? Through the application of different living lab methodologies, such as participatory designs, open lectures, intergeneration educational actions, and other social, public, and seasonal events. All these can happen in different infrastructures. So we have three infrastructures here: Smart Home Healthcare Transitions Living Lab and the Human Centrifuge Rehabilitation Living Lab, where more than 3,500 beneficiaries have participated in co-designing, developing, and testing different solutions with many, many hours of piloting, testing, and experimentation. So all these can be translated and replicated, and specifically in the Shift Hub project, we have replicated these living lab methodologies, where we have designed and participating in different living labs in Greece, in Romania, and Portugal. Here are some pictures of the different living labs that happened during the Shift Hub project, during this replication of the methodology of the living labs. So how can someone replicate a living lab? There are different steps. You can visit the Enol website and browse in a different living labs across Europe that are related to your sector. Get in touch with this network and reach out to specific living lab to express interest or ask questions about the method, about how you can also build such living lab. Join as a partner or participant, depending on your role, and apply to become a member, of course, for an Enol membership. But how to run services and methodologies within an established living lab, this is more for guidance on implementing and managing services and methodologies within a living lab to facilitate innovation, testing, and evidence-based testing and user-driven development. You can get in contact with us and specifically with Professor Panagiotis Bamidis, who is also the director of the Medical Physics and Digital Innovation Lab. And this is, I hope I was on time. This is it for Living Labs. Thank you very much.
Thanks a lot, Anita. Perfect. So before we have the Q&A session, we have one last presentation to share. And with that, so in our last presentation, in our build and boost pillar, it's not about a Shift Hub service actually, but rather about one of our really strong collaborations with that we established together with the RAISE project, which is all about secure data sharing. And therefore, it's now my pleasure to give the floor to the coordinator of the RAISE project, which is Evdokimos Konstantinidis. Evdokimos is an assistant professor in the Digital, Technological, and Open Innovation in Health at the Lab of Medical Physics and Digital Innovation, also at the Aristotle University of Thessaloniki. And he will now introduce the RAISE platform and their benefits in really secure data sharing of, secure data sharing of health data. Evdokimos, the stage is yours.
Thanks, Elena. Good morning to everyone. Thanks for the introduction. I will keep it short, focusing mainly on the opportunity and on the long-term actually results. So RAISE is a consortium of many partners lasting for 4 months and 40 months and actually concluding in end of January. And the main idea behind this is democratizing the data sharing data spaces while at the same time creating a smart health data space, a smart data space actually, and then I will explain why it's health and related to Shift Hub. So the idea is, most probably you have heard about it. It's about copying the peer-to-peer home learning platforms, but now for datasets. So it's the idea of data owners keep their datasets in their premises, and then the guests are algorithms that visit the data. So it's about moving from data sharing to data visiting. How this is done, the data owners have the data in their premises or in a hospital, most probably. They keep the data there and they make them accessible by others by sharing only metadata and a small sample of the dataset, a small portion of the dataset as a sample. Researchers or companies can find these datasets, can download the samples, prepare the algorithm, and execute it on the real data that is taking place, the processing takes place in the hospital, for instance. So how this is done? Here we have the pink color. Imagine that it's the infrastructure of a hospital with the datasets there. A processing script comes, a trace execution environment is created. The datasets that will be processed are copied in there. The script is executed against the dataset. The results are produced. The results go back, and then the trace execution environment is deleted. You can define who processes your data. You can also ask to audit the results of your data, so you don't become only you as a data owner. You're not only in control of who processes your data, but also in control of the results that produced after processing your data. And you are also aware on how many times your data has been processed. So you can also measure the impact, because there are many cases that we open data or we do an amazing effort to open the data, because opening data is not that simple. And then it would be nice also to see that, you know what, this data, nobody is interested in this data. Let's focus or spend our resources in something that would be useful also for the researchers. So Raise is not just another data portal, but we create the infrastructure for providing this brokering service. And this is exactly what was the common point with the Shift Hub. So in Shift Hub, under the Build and Boost, we offered this service, the data sharing platform as a service, actually. So what was in it for us mainly? It was that Shift Hub gave us the opportunity to explore how Raise can provide this infrastructure as a service, but in the health domain. This was really important for us in order to understand how we can, having the infrastructure, how we can provide targeted service or tailored services to health in this case, but also to other domains as well. You can find more information support here if needed. And these are my contact details, but I would like to express our gratitude for Shift Hub that believed and included Raise in the portfolio of services. Thanks, Alina.
Thank you very much, Evdokimos. So it's really a pleasure to have that strong collaboration with you together, because we really believe that a lot of our community members and ecosystem stakeholders, they're really in need for secure data sharing platforms. So this collaboration really offers a strong branch of that to further foster the development of the smart health solutions by starting working and sharing on the data. Well, thanks a lot. We actually have a short time frame for questions now. So if someone from the audience would like to ask some questions related to the services we have presented so far, please feel free to reach the hand or unmute yourself or use the chat like we have done before. Quickly seeing if someone's raising their hand. So if not, there will also be later other Q&A sessions, or as you've seen, all of our speakers have shared their contact details. Also, the webinar is recorded, as I've already said at the beginning. So you can also go back on YouTube later on and hear that and rewatch that. And we will also share the slides with all the participants later on. So you will get all contact details also via email. All right, if there are no questions, let's move forward with our next pillar. So now we would also like to look at the services under the Connect and Thrive pillar. And one of the main assets here is really the community platform, to which now Gabriele Casalini will introduce us. Gabriele is a tech project officer at the European Digital SME Alliance, where he manages EU-funded projects on different topics like ICT technology, standardization, and e-health. And also within that context, we're really happy to have him with us in the consortium, because he coordinates also the Shift Hub focus group on e-health. Gabriele, we're looking forward to your presentation.
Thank you very much, Elena. And I already shared my screen, and I will provide a short overview of the community platform and the focus group, which are the main places within Shift Hub and within the community in which you can interact with other stakeholders. So just a brief mention, we have been creating with Shift Hub alongside the project a very strong community network, which includes different stakeholders from technology providers, but also knowledge and infrastructure providers, academia, financial intermediaries, and also public authorities, including a core base of also companies, especially European SMEs, and even patients. So our objective was to bring together this community for providing specific and targeted services for all the targeted stakeholders group. So regarding how the community is coming along and interacting, we have been focusing on specifically on providing opportunities in smart health and digital tech, connecting also the various community stakeholders, empowering them, connecting them with the other actors in the health ecosystem, and fostering the uptake of these technologies. Now we have more than 750 international community members that are registered through our platform that you also used for participating to this webinar. And the platform is the place that supports all the activities for the community. A lot of focus has also been put in the creation and hosting of events, including international events and also networking opportunities. And also I will have a brief mention of the marketplace, which is where you can put opportunities to be shown to the whole community. Regarding the eHealth community and the platform in particular, together also with the focus group, they have been vital in ensuring the possibility to offer international events with also a particular focus on funding and business-to-business matchmaking. It was also important to connect the various stakeholders through matchmaking activities, networking, especially through the automatic services that provide one-to-one meetings, together with also automatic functionalities of looking at potential partners, connecting, sending direct messages, and also connect with them through the platform itself. Regarding a few events that we had in the last period from the focus group, which is managed by the European Digital SME Alliance and strongly focuses on the digital technologies that support the healthcare sector. For instance, we have been talking about AI and data space, which has been very important topics, not only at technology level, but also at the policy and standardization side, especially at European level. But we have also hosted, as also my colleagues have said before, open innovation workshop, onboarding workshops for the health data space, and even capacity building workshop accompanying the journey for companies especially. Regarding the community platform itself, as I said, we have hundreds and hundreds of profiles already registered. So now it's mostly it's also important to continue to bring opportunity to the communities even after the project end, and the infrastructure that has been created it really offers a lot of functionalities, especially in the field of matchmaking and networking opportunities, that it's vital, especially to connecting international stakeholders between themselves. For instance, here you can see how for matchmaking events we can have a list of participants to the event, and you can invite other people for one-to-one matches, and the system is completely automatic. And this is particularly important and useful, for instance, in the submission of proposals, especially for European funded projects. It has been quite vital for supporting consortium building and also your funding events. As mentioned, for instance, we have in the past hosted a international brokerage event in health innovation, especially focusing on the UCalls and also with a strong matchmaking mechanics. And we also had this event also done this year for the second international brokerage event. But we also collaborated and provided opportunities, especially in the financing and investing field, providing support through mission events, as we did in collaboration with EU Business Hub, and also organize events more on the pitching session side with feedback from venture capital representatives. Regarding another opportunity, which is also important, especially as the project is ending, it's also to participate and be visible within the community through the community marketplace, which we have created to allow all the different type of stakeholders to publish their solution, products, but also partnership opportunities or even other needs to be visible together with their profile and their organization, and they will be visible to all the members of the same community, which every user can publicly scroll the catalog to find suitable partnership or service that they are looking for, connect with them through even events, because every event will show your opportunities once you register, so you will be publicly visible. But you can also send direct messages through the platform to other profiles, and also you can also register opportunities, and they will be interoperable within all the communities of the partner or platform. So just a few steps. You already know potentially how to register and how to build your profile, but I take this opportunity to also encourage you to even access the marketplace, especially, and look for other solutions, look at how other members, and also we encourage networking and collaboration. So you can see the list of all the members of the community and feel free to try to reach out to them and also find the right partners for project funding or business opportunities. And me and our consortium partners, we're also here and available to support you in this collaboration. Regarding future partnerships and especially upcoming opportunities, given that we have created this strong base, this strong community, and the platform will remain operable even after the closure of the project, if you're interested to find synergies between your project, your organization, your association, and the Shifter community, please feel free to reach out to me or the project coordinators, and we will be happy to talk more about particular opportunities for exploiting or providing opportunities to the Shifter communities, such as hosting events, roundtables, specifically matchmaking related to health, or even distribute to the community very important opportunities or funding open code that will be potentially launched from your side. And we also invite you to explore the functionalities, and if you have any questions, to reach out to us, especially in light of any collaboration. I also wanted to invite you to the upcoming demo day, which will be hosted on the community platform, as I mentioned, in January. So I will send the link soon in the chat. 13 January 2026, the demo day focused on Taltech. So you are all invited, and looking forward to see you.
Thanks a lot, Gabriele. So again, before we go to the next speaker, I would really like to emphasize, Gabriele already said it, but the community is going to stay alive even if the project or the funding has ended. So there will be content provided. You can still use that, and we highly encourage you to use that also for disseminating your projects, other webinars. So please use the community to reach out to all the stakeholders involved. If there is something you would like to share or host events online, for example, if you're a hub, if you're a project, a European project also. So make use of the community we have built. We will also do it our own. So there will be upcoming events like other focus groups or the demo days. But again, I would like to emphasize that using the community is also open, of course, to all our community members as well. And now we would like to continue with the introduction of the next service under the Connect and Thrive pillar, for which I would like to welcome my colleague, Leonie Fahrt. She's a project consultant at the Steinbach Europe Center in Germany. Here focusing on health-related projects. And in ShiftHub, she leads the work package on stakeholder engagement and community management. And she will now introduce us into the entrepreneurial discovery workshops and also the policy recommendations that were drawn from them. Leonie, please take it away. You're muted.
Okay, sorry, that
Okay.
has been a problem with my speaker. So then, thank you for the nice introduction. Alena, you should now all be able to see my presentation, right?
Yes.
Perfect. Then let's dive into the topic. So first of all, a very brief overview into the context of the smart health ecosystem in Europe. So as some of you may already be familiar with the importance of the smart health ecosystems and their role in Europe's vision to modernize healthcare and strengthen resilience, some of you may not be so familiar. So to give you a very quick introduction, the EU has laid a strong foundation by establishing the European Digital Health Strategy, which includes several initiatives as the EU for Health program, the forthcoming European Health Data Space that will facilitate a secure and interoperable exchange of health data. However, the success of these policy always depends on the regional ecosystems and innovation hubs, which are essential for translating those frameworks into practical solutions that improve healthcare delivery and foster sustainable growth. And therefore, at ShiftHub, we aimed to gain a better understanding of regional ecosystems. So we gathered evidence during 3 ShiftHub entrepreneurial discovery workshops, which has been held in Central Macedonia, Northern Portugal, and Baden-Württemberg in Germany. And a central element of the workshops was the presentation of panel discussions featuring regional stakeholders from the smart health ecosystem. And each panel was featured with representatives from different sectors, including researchers, technology transfer offices, regional initiatives, innovation hubs, venture capital organizations, innovators, entrepreneurs, and regional policymakers. And the methodology was based on a moderated structured panel discussion covering 3 topics. So first, the challenges, barriers, and needs assessment, then the opportunities, and last, the comparison with other ecosystems. And the answers and discussion compared and conclusions and recommendations were formulated, which provided a comparative understanding of these challenges and opportunities across different European ecosystems. And if we have a closer look on the key challenges which we have identified through those workshops, we have identified 5 key challenges, which are the funding bottlenecks, the data infrastructure gaps, the regulatory hurdles, especially for all smart health or in general for health-related issues, but for smart health especially, the fragmentation in the ecosystems per se, as well as an uneven visibility and branding. And based on that, we have formulated several recommendations which has been drawn from these workshops, which are the first, to close the funding gaps for clinical validation and early stage growth. Second, to develop interoperable health data infrastructures like the planned European Health Data Space, to promote investor education and incentivize long-term engagement, to strengthen networking, mentoring, and cross-sector collaboration, and to enhance the visibility and internationalization of regional ecosystems. And to provide you with a quick overview of the regional differences, I have highlighted here some regional snapshots. So only a very, very brief introduction into the several regions, but yeah, to give you a short insights. So first of all, in Central Macedonia, here we have an emerging ecosystem with promising startups there, but here there's still a need for networking opportunities, pre-seed funding, and in general, they really need a unified strategy in that. In Baden-Württemberg in Germany, here the ecosystem is more on a mature level. And you have strong accelerators there and also quite nice support programs. But here there's a lack in visibility and data infrastructure and early stage funding. And in northern Portugal, you have a strong research base, but here it's still fragmented. They struggle with mentorship and mid-stage funding gaps. And if you're interested to learn more about, I would like to encourage you to dive deeper into the policy brief. We have it available on our ShiftHub website, or you can find it by scanning the QR code. And with that, I would like to give the floor back to Alena. Thank you for your attention.
Thanks, Leonie. Now we actually have a short slot for questions. So maybe related to the second pillar, the community platform or the policy recommendations. So again, if you would like to ask a question, feel free to raise your hand or use the chat. Just quickly having a look at that. Oh yeah, sure. Leonie, can you share the link for the policy recommendations? Thanks. Okay, if there are no current questions, we can go ahead because there will be another.
You're muted. Okay.
Yeah, sorry. There will be another Q&A session later on anyways. So now we would like to go to the last pillar, which is the Learn and Grow pillar, which is all about now expanding the knowledge and sharing knowledge. And for introducing the first service in that pillar, I would like to give the floor again to Joana Carrilho from the University of Porto to introduce the educational repository.
Thank you again. So the educational repository, as the name says very bluntly, is a repository of educational contents. You can find it on our website. Sorry, let me move. So if you come to the ShiftHub website, which hopefully you're already familiar with, under the Services tab, you find this scheme that you're already familiar with all of the pillars. And then under Educational Repository, you have a brief description of what it is. And then here you have this Access Our Educational Repository here. On the bottom, I don't think you can see my mouse, but you have it in green here, Access Our Educational Repository here, which will then bring you to this page that you can see here. And as you can see, we've tried to tag all of the available training programs by type of program. So either it's just a resource as a scientific publication, a standalone video, an ebook, or you can have it through a online platform of contents. We've tagged it whether the things are open access or they require any type of payment. So you can see here whether or not you get a certification. What is the type of source where you get it from? So is it from a national initiative? Is it from a private company that provides these trainings? Is it from a European project type of thing? You can see by the type of audience, so you can see if this specific training is adequate for you or not, and the type of language in which it is delivered. Then if you move down, here you have, we've put this into different types of topics, just randomly opening digital health, for instance. You have here all different courses. If you go to this first one, you have this basics of digital health and introduction. So as you can see, you can find the tags. It's a video, it's an open access, it comes from a Horizon Europe initiative, and the video itself is in German, but subtitled in English. So if you click on Learn More, you will directly be taken to YouTube, and then you can see the video itself starts running. I'll stop it so it doesn't talk over me. But as you can see, you can find all of the video here, and you can access that information. So this is true for all of the contents here. So you just have to look for the topic that you're interested in. As you can see, we have quite a big library of topics. Here you can go again for instance, this first one on artificial intelligence is specifically directed for healthcare professionals. The next trend, for instance, is for students and researchers. So because you can see you have different types of contents for different types of audiences, and all you have to do is come here and click. So this is from a user perspective.